The president promised Obamacare would get more people insured and bring down the cost of health care. Well, it looks like neither of those things may happen. According to a new survey by InsuranceQuotes.com, 64% of Americans who lack health insurance right now say they don't know if they will buy coverage on Obamacare, and that would drive up health care costs for everyone. Congressman Peter Roskam joins us. Nice to see you, sir.
Thank you, Greta.
So if the 64% of uninsured people don't buy into Obamacare, then what happens?
Well, look, I mean, the whole premise of Obamacare is that it's going to be all these healthy people coming in and paying a higher premium and playing a more active role. They don't participate, then you're into this same old problem, and the problem actually gets exacerbated. So costs go up, few people have coverage, and this is, I think, all of the false premise of Obamacare. During the campaign to pass it, the president was basically pumping sunshine. He was over-characterizing the possibilities, and he said that rates were going to go down. They're not going down. They're going up.
So the whole idea is that if everyone joined in through money in the pot, that we could then have some risk management, that we'd pay for the people who are sick, and the people who are healthy wouldn't be drawing any money out of the pot because they would be healthy. That was the thinking. With the 64% now, it's curious why they would, if they think they're so healthy they don't need health insurance, even if they get caught. I think the first year they're only going to pay $95 a penalty. That's probably a lot cheaper than buying into some health care.
Right. And so this becomes a highly manipulated system then. So then the federal regulators have to come up and they've got to say, well, obviously we need to increase the penalty. We need to increase the adverse impact of not joining our pool. And so you get to this point where all of a sudden folks are beginning to say, hey, I'm being forced into this system and my costs are going up. I thought this was going to be a benefit, and it begins to unravel.
And of course it's not going to be too popular when they see that the ones who are enforcing this penalty is the Internal Revenue Service, which is under fire.
Yeah, you can't make this up. I mean, if somebody, Hollywood scriptwriter, came to you and said the very institution that is poised to enforce an incredibly intrusive thing, that is personal health care for each individual American, they are now under fire for manipulating and targeting people based on their political beliefs, it is so unseemly and so difficult that it's hard to even get your head around.
It's even worse, though, because the whole idea was that all these states would set up these exchanges where people went to get their insurance. A lot of the states, about 26 of them, said they are, so the federal government has to set up the exchanges for these states, and they haven't gotten around to doing that. Plus, there isn't the money, and so the Secretary Sebelius apparently has been trying to get some funding. Now she's getting heat from Senator Orrin Hatch and others that she's trying to usurp the role of Congress of being the appropriator. So it gets so much more complicated, and we haven't even gotten to January 1.
Well, and the other thing is that the administration was clearly slow-walking these regulations because they didn't want this out in the context of a political campaign. So avoidance, push it off till after the election, and now they're trying to jam this through in a collapsing period of time, and they're not ready. And there's an open question as to whether it's appropriate for Secretary Sebelius to solicit seven-figure donations from the very entities that she's got the authority to oversee.
I don't think that's an open question. I think if she's going out and trying to hustle money from the people that she regulates or oversees, that's improper. If she went out to, if she tried to hustle someone else who she doesn't regulate, that would be a different question.
Fair enough.
But I mean, if she regulates them or oversees them, then she shouldn't, because they're going to try to curry favor. But anyway,
right.
Congressman, nice to see you.
Thanks, Greta.
Straight ahead, what did